这里还是剩你哈，到底。是。错。
Hi everyone, can you hear my voice? I'm Tian, staff from Penang Adventist Hospital. First of all, thanks everyone for joining today's webinar with our Dr. Tang Weng Chong. And thanks for the hiker group to invite us for another talk. So the talk is supposed to start at 2:30. I'm Tian, staff from So shall we start soon or shall we wait for more participants to join us? Mr. Kenny, is your members coming up soon?
Maybe we'll go in 5 more minutes. Thank you. Can or not?
Okay. Okay.
Good, thank you.
So anyway, we have also linked this the webinar to YouTube Live. So because our Zoom account can only accommodate like 100 participants, so for those members that are unable to join after exceeded 100 participants, then you can actually go to our Penang Adventist Hospital YouTube channel to watch over there. It's live. So we will start in another 5 more minutes. Thank you. Good afternoon. Once again, thanks for joining our webinar today. So shall we start the talk? Doctor is ready? So today we have actually invited Dr. Tang Weng Chong, which is a consultant orthopedic and sports injury surgeon from Penang Adventist Hospital, to tell us more about how to protect our knee through science of sports. Okay, so Dr. Tang, I'll just pass over to you.
Okay, hello everybody. Yeah, we'll start anyway. Let the people slowly come in. First of all, can you all type a Y if you can hear me clearly, clear and nice? Can everybody type something so that we confirm that you can see us well and do I see the screen? Ken, did you see the response?
Yes.
Everybody can
Yes,
hear?
our participants can hear. No problem, Doctor, you can go ahead.
Okay. All right. Okay. So as shown, today's topic is protecting your knee through the science of sport. We have to thank you, the Anak Hutan group, for inviting me to give a talk on this. Okay. So what are we going to talk about today? We're going to talk about first, we're going to talk about some basic anatomy of the knee and telling you what is a cartilage and what happened to it if you damage your cartilage. Okay. And then we're going to talk about, discuss, is exercise bad for your knee? Should you exercise? Should you do your hiking? And we're going to talk about some practical tips to protect your knee when you do hiking, when you do cycling and running as requested. Okay, a light touch on each of these. Of course, all of these, in fact, is a very big topic. So we're going to have to do a light touch on all of this, and then finally we will going to look through the literature and see that what exercise will help you to protect your knee. Okay, this is what we're going to talk about today. All right. Okay. First of all, you need to know a little bit on basic anatomy and some general knowledge. Otherwise, you do not know what we are talking about here. Okay. This slide shows pictures of your leg, obviously, without skin. Okay. So you can see the thigh. Our leg essentially consists of this thigh muscle, which we call a quadricep muscle. Quadricep means four-headed. Okay. Quadri is four. You see, there are four big muscle groups. A group of muscle on your thigh called the quadricep, which is one of the most important muscle on your body. Without that, you cannot walk, cannot stand properly. Okay, and below here is the calf. Right at the center is your knee joint. Okay, then if you look at this picture here, in our knee joint, we have the knee joint consists of three bones. Okay, number one is this thigh bone, we call it the femur, followed by the bottom one is the tibia, we call it is our shin bone. Okay, and then you have this small bone at the center, we call it patella in medical terms. In layman term, you call it a kneecap. Okay, so a lot of people will misunderstand that a kneecap is your knee. Actually, it's not. Kneecap is just one small bone that is in front of your knee joint. Okay, your knee joint consists of three bones. Okay, and this bone here, this funny bone, the kneecap here, is suspended in the center of the knee, suspended center of the knee by the muscle and the tendon on top from the quadricep here, and another tendon here called the patella tendon. Okay, it's like suspended at the center. But what is important for you to know today is the most important things inside your knee joint is this white color thing, this one. Now this white color thing is called the cartilage. This is the cartilage, okay? Cartilage is one of the most important things that we're going to talk about because it's a smooth coating at the end of your bone, inside your knee joint, one of the most precious things for you. If you damage it, it does not grow back, okay? And if you damage this cartilage, we call it osteoarthritis, okay? Meaning that just like arthritis, like old people, okay? They wear out this cartilage here. The normal cartilage is about a few mm thick only. Okay, next slide. Let's see. Next. Where is the? Sorry, I'm stuck on this. So why is it not moving? Why is it not? Why is the slide not moving? Change. Okay, I'm sorry. I just stop sharing and come back again, okay? Stop sharing and, oh, okay. Something wrong with that, okay. So now we back to sharing screen. Okay, now we move. All right, okay. The next slide shows the pictures of cartilage wearing out, okay? So you got a smooth cartilage at the end of your, inside your knee joint, very vital, absolutely important structures. And if you wear out like this in old age or in an injury, what you're gonna get is osteoarthritis of the knee, okay? Like the old grandmother has complaint of pain of the knee, okay? Osteoarthritis. And the picture below here is just to show you on your kitchen table what a cartilage looks like. You all have seen it before. This is a animal leg, okay? If you can see the leg that you use to cook your soup, okay? If you see this white color thing here, these are cartilage. And on the right side is the chicken wing, okay? Even inside the chicken wing, you have this white color here at the end of the joint. It's called cartilage. Okay, the next slide shows is a scope pictures. Scope means we put a small camera inside your knee joint and then we view inside the content of your knee. Okay, what we can see is this is the thigh bone and this is the kneecap on top there. Okay, now you have the thigh bone on top of the thigh bone and you have this smooth white color thing. This is how a normal cartilage would look like in real life. Okay, this is real pictures of my patients. Okay, and what we're showing here with the blue arrow is when the cartilage is damaged. Okay, like this patient here is, he worn out his cartilage when he's doing exercise, you know, climbing stairs and things like that. That's how it looked like with a damaged cartilage. And the next slide shows again a big hole in the center of the cartilage of a kneecap. This is my patient also. He damaged his cartilage. Now you can see actually deep to the bone. You see how thick this one is? Not very thick. You can see the bone here. Okay, bone is here. All right. And this patient, he damaged his cartilage. Now, as you know, cartilage does not grow back. So we have to do a surgery before it got worse and become a full-blown arthritis. We put a scope inside the knee joint and then we patch the hole using a gel foam here, a very expensive gel foam here, to patch up the cartilage hole and let it grow cartilage. This is after patching. This red area here is after patching. Okay, the hole has been patched. And after a year or so, it will grow up to cover up the cartilage. So we save the cartilage. Okay, and these are different stages of cartilage wear. Okay, stage 1, stage 2 and 3 is moderate cartilage wear, moderate arthritis with the corresponding X-ray at the bottom. And the grade 4 is the most severe form. Okay, usually only old people get it. Okay, and as you can see, for grade 2 and grade 3, if you unfortunately get that, you may need something called cartilage regeneration. Whereas in grade 4 is too late, you need to go for joint replacement. Okay, this is just some basic concept for you to understand. Now, is exercise bad for my knee? We have to screen through the research to find this answer. In fact, there are some big study, for example, this Framingham study, which conducted from 1948 to 2005, is going through a big, lengthy period of follow-up into all the people who exercise. And their conclusion is, no, exercise does not increase osteoarthritis. Okay, and another Australian study in 2007, it said exercise actually increase cartilage thickness. That means the more you exercise, your cartilage actually grow thicker. And they found that running does not increase the chances of osteoarthritis if there's any runner there. Okay, good news. Okay, running action actually half the incidence of knee osteoarthritis compared to those who walk. Because running, as you put more stress to your cartilage, they grow thicker. So sport is definitely, undoubtedly beneficial to your health. But there's a but. We can only recommend that you take up a sport that is suitable for you, okay, appropriate for your age and your physical fitness. Okay. Now, sport is also the best preventive and curative treatment for osteoarthritis, because it promotes the nutrition and mobility of the cartilage. It's also strengthens the muscle and tendon and make your joint less burdened. A well-developed muscle will better cushion your joint, and the energy is absorbed through the muscle, not through your joint. So it protects your cartilage in a way. Okay. Now, so sport will help us fight against the aging of your joint structures. Okay, then, why then a lot of top classes athletes, the people who are very physically active or ex-nationals, footballer, ex-state footballer, why do they suffer from arthritis? Why? How do I explain that? Okay, then you must understand that the risk factor that actually threaten the sports people. Okay, a traumatic injury to the joint can actually damage the cartilage and the ligament. And also meniscus tear, which is an absorber inside your knee joint, it can damage your cartilage. And incorrect techniques, wrong technique of using in sports, okay? Misalignment of a joint. The joint was born with the bone sengek, you know, the joint are not in proper positions, you know, they tend to damage, just like the alignment of our car tires, they are not well aligned, then you drive your car to KL every day, it wear out. Okay. Okay, for example, runners with incorrect foot movement can traumatize their knee. The tennis player who use only muscular strength of their arm instead of their whole body, you know, they risk injuring their shoulder. And all this, if done repetitively, they can lead to osteoarthritis. Okay. Osteoarthritis are common in athletes as they get older because professional athletes in general, they overuse their joint, okay? They actually do more than what their body can do, okay? Unfortunately, because they are professional and they have to cari makan, okay? So no choice. Stats explains it. Okay, and also the fact that some of these professionals, in fact, they are born with an abnormal joint in the first place. For example, you can see at the bottom, a normal joint, a mal-aligned knee, a knock knee. Now, if you have this kind of knock knee or naturally curved knee like this, now what will happen is you can see the weight are not evenly distributed, so your joint worn out faster, no doubt about it. Okay. So if you eliminate all that factors, like, you know, they born with abnormal joint, they have previous injury, they continue to play sports, you know, things like that. Researchers actually found there's no link between exercise and arthritis of the knee. Okay, so you can exercise, but be careful of the sport that you choose. For example, if you are prone to ankle sprain, if you are the guy who gets sprained all the time, it is better for you to take up cycling rather than tennis. With tennis, you can sprain your ankle, right? Okay. If you complain of back pain all the times, maybe water sports are more recommended than running sports. Just choose a sport. Okay. Now, hiking and mountaineering. Now we talk about that. Okay, the benefit of hiking is very good. You see, if you browse through the literature, you see hiking reduces the stress-related physiological response, meaning that it reduces your stress. Okay, study shows that it reduces your stress. How they do it? They look at the people who do the hiking. They test their saliva, the hormone in their saliva, test their blood pressure, and test their heart rate. They all got better. So hiking helps you to relieve your stress, definitely, proven by a physical evidence. Okay, and hiking also improve your mood and emotion compared to an indoor running. This study here compare indoor running on treadmill compared with hiking. Hiking does much better. Okay, so of course, when you see all the flowers and trees and you talk to your friend, your mood and your emotion gets better. Cures your depressions. Okay, now in hiking there are two movements. One is downhill, one is uphill. Okay, these are two different types of exercise for your muscles. Okay, for downhill, it is an eccentric exercise. I will explain that later. Eccentric exercise means the muscle is lengthened or muscle become longer under the load when you're applying a braking force. On the other hand, uphill walking is a concentric exercise. The muscle shorten when you contract the muscles. Okay, for example, when you're lifting a dumbbell, this is just to explain what is an eccentric and eccentric exercise. When you're lifting your dumbbell, when you're lifting up the weight, your muscle contract, your muscle harden, okay? And the muscle is actually shortened at the same time. So this is called concentric muscle contraction. Eccentric muscle contraction, you try to harden your muscle, but your muscle is brought down by the weight. And it's actually become longer when you're trying to contract them. Imagine that. Now this is an eccentric exercise. Okay. Okay, again, in eccentric exercise, the muscle become longer with you trying to contract the muscles. This is happening when you're going downhill. And an eccentric exercise, meaning going downhill, will always cause more muscle soreness. But it causes more muscle growth. Okay, no pain, no gain. So when you go downhill, it's painful tomorrow. The 1 or 2 days later, you will get more muscle soreness, more muscle pain after a few days with going downhill. I think for seasonal hiker like you actually understand that. You know, wow, downhill causes more muscle pain. But good news is cause more muscle growth also. With the catch of it, of course, muscle have the muscle that most work out it work your gluteus, your butt muscle, your thigh muscle, your calf muscle, the side of the calves, everything is work. So it's a absolutely very good workout going downhill. It's only used half of the oxygen of going compared to going uphill. Okay, it's spend less energy than even walking on the flat ground, but yet it grow more muscle for you. Wonderful, isn't it? It's easier to do, but can do damage to your cartilage. Bad news. Okay, that you have to be careful though. So that's why we need to look at how to protect your knee when you're going walking downhill, right? Okay, you should always land with your knee slightly bent, because if you land with your knee straightened, fully straightened knee, the impact directly, boom, goes down from your thigh bone to your shin bone, and your knee will absorb all the impact. So remember, always landed with your knee slightly bent to absorb the impact. Your body should stay low, and your heel should land first. Do a heel strike first, and you must keep your knee, your thigh muscle, your quadricep means your thigh muscle activated, means you maintain activated. Okay, harden your knee rather than make it very soft, floppy. If you landed with a floppy knee, you get more injury. So you need to tighten up your muscles, although with a bent knee. Okay, of course, tighten up your shoelace. You know, make sure your shoe is not too loose, because you tend to sprain your ankle when you go downhill. All right. Now, right. Again, this picture shows heel strike first. Okay, heel strike first. Now, hiking poses a high risk to ankle sprain as well, apart from knee injuries. So it makes sense to improve your strength and mobility of your ankle joint, also to protect yourself. Here are some tips that you can practice before going hiking to strengthen up your knee. Okay, make sure you have good mobility of your ankle. Okay, you look at your ankle, you do a tiptoe exercise to train your tendons and your ankles. Okay, one leg stand and squats to strengthen your muscles, to get yourself. And if your ankle is very tight and has very little motion, you need to make sure your ankle is flexible. Okay, do exercise like this, you know. This is the position how you sprain your ankle. Okay. Now, you can do a one leg stand on this to train the stability in this position, so that in case you sprain your ankle, it is not so easily torn your ligament, because you are used to this movement and your muscle are trained, are record to take this kind of movement. All right. Now, what does the research also shows that if you perform a 20 minutes downhill walking 1 week or 4 weeks before you go for a long downhill hike, this will reduce the damage to your muscle. When you go downhill, it's actually damage a lot of muscle. Of course, you damage the muscle, later you'll build bigger muscle, of course. But in order to reduce this muscle damage, you need to do preconditioning exercise. If just, for example, if you're planning a long hike, you know, like to, I don't know, maybe K2 or go to Mount Everest, before that, you need to precondition yourself. Of course, you don't walk in, you know, 1 month, number go for hiking, and you go straight to Mount Everest. That is going to cause a lot of muscle damage, because the research shows that if you do a 20-minute downhill walking about a week to 1 month, it means that the durations of the protective duration is about 1 month. 1 month, within 1 month, before you go for a long hike, if you practice going downhill in that ratios, you will reduce the muscle damage during the actual long hike. Get it? Okay. Okay. What about trekking pole? Does it help? Okay. If you look at the literatures again, look at the research, it shows that trekking poles can help to take off the impact from your knee. Yes, it takes off the impact, it works. Especially when you go downhill, it gives you extra stability to prevent you from falling down. Yes, it's proven to do that, okay? And of course, 2 sticks is better than 1 stick. But 2 sticks, sometimes the research shows 2 sticks is better than 1 stick, but sometimes it's not so convenient for 2 sticks. If you do real mountaineering, then 2 sticks. You just do hill walking, maybe short distance, then one, okay. Okay. Some tips on the proper way of using trekking pole. I'm sure all of you are very good at it, but just some reminder. Okay. The pole should be angulated slightly forward when going uphill, you know, like in the left side pictures, the hiker is like planting and trying to pull himself up. Okay, that's a wrong technique. Okay, the proper technique is to put your pole behind and push yourself up. Okay. Again, this picture shows a wrong way of using it. You know, number 1 is too long. Number 2 is using it like a fork. You know, poke on the ground and then pull herself up. That is a wrong way of doing. Pole is too long. It should be below the heart level. This is the optimal way of going uphill with the pole pushing. Using 2 poles, pushing yourself up. Okay, it's a push rather than pull. Now there's different way of gripping your trekking pole. Okay, when uphill and downhill is change. You switch it and you make the pole longer. Okay, switch it like a tongkat. Change the grip. Okay, it's going downhill. Okay, one more thing that worth mentioning, maybe for amateur hiking, probably amateur hiker, probably not so much for the anak hutan group who are all professionals. I see a lot of hiker like to wear this kind of shoes. This is like a soft top shoes. Okay, the soft top shoes is like your foot can actually move over the sole just like this one, without even turning your ankle. Okay, it slip. Basically, the foot actually slip out from the white color sole here. Okay, sorry, white color sole here. So you tend to sprain your ankle when you do that. Okay, so don't use this kind of soft top shoes, you know, because under extreme pressures, your foot will slip and you will sprain your ankle. A proper hiking shoe does not allow you to do that. They are more robust. A proper hiking shoe, it's important to use proper gears, not to, otherwise the incident of sprain will increase. Okay. Now, I was requested to talk a little bit on cycling and knee pain as well. So cycling is what we call a repetitive exercise. You keep on doing the same move. You go on and on and on. A professional cyclist will ride 25,000 to 35,000 kilometers a year. Whereas a recreational cyclist, usually they report in the literature, they report 7,000 kilometers per year, which is quite a lot as well, okay? 5,000 pedal revolutions per 1 hour of cycling, okay? That means in 1 hour you pedal your cycle 5,000 times easily, okay? And if you browse through the literature, the research, the knee injury is the most common injury in cyclists as well. Tissue damage occurred with repetitive sub-maximal load. That means you're not really using your whole force, your full force, but you just use half of the force, but because you keep on repeating it, and it causes overuse injury, not enough time for rest. Now, overuse injury occurred on this kneecap here most commonly. The one, this little, as I mentioned, the kneecap, the patella, this little bone keep on grinding up and down and up and down for 5,000 times per hour easily. Okay. What are the causes of knee pain in cycling? The common causes. Why? How does people get knee pain in cycling? Now, you guys are professional cyclists, so we just browse through what the journal say, what the literature says. Usual causes is the saddle too low. Okay, the seats is too low, and you get knee pain. Or your foot is in pronation, meaning that the foot that is on your pedal is rotated or inside or outside. They're not in neutral positions. That causes knee pain also, because imagine you turn your foot and your knee will turn as well. Okay. And another cause is too much resistance on your pedaling. Okay, you have a wrong gears. Okay, or you have a cheap bicycles. Okay, and yeah. The idea is to maintain about 80 to 90 rotation per minute cadence, okay, meaning that how many pedals, per minute, okay. You need to avoid heel when you're injured so that your knee get adequate rest. If you don't get adequate rest, the injury will increase. So these are the common causes of knee pain in cycling, okay. These are the so-called bike feet. You see, it's a very important factor to avoid knee pains, a proper bike fit, especially the seats, okay? But of course, other things matter, the distance of the seat from here to here, the height of the seat, and how high the handles. It's the same for road cycle and mountain bike as well. But as a general rule, pain, if you get a pain at the back of the knee, your saddle may be too high. If you have suffering from the pain at the front of the knee, your saddle is too low, okay, as a general rule of thumb. So what is the ideal position that you should set your seat level? I bet all of you have your own method of measuring the most comfortable one. But what does the researcher shows? You see, there are research done on how high you should put your seat. Okay, some are complex, some are easier. For example, some with under this research called Hamley and Thomas, they use what we call the inseam leg measurements. Inseam means inseam means in between your groins, okay? Like this picture, they put a ruler in between the groin, at maximum area. Just go up there until to your groin, until you cannot reach. That is the distance of the inseam. If you can see my arrow, my white arrow here, difference of the inseam is from that ruler down to the floor. And it says that if you get this measurement, you times 109%, you get the best seat position. It makes you last longer, okay? Now, just because the ruler is there, don't misunderstand what I mean, okay? It produces longer time to exhaustions in your cycling, okay? In your cycling, all right. Another researcher showed trochanteric rank. It means trochanteric is a prominent bones at the side of your hip. If you put your hand at the side of the hip and you feel an area of prominence, and that is called a greater trochanter. Greater trochanter, you measure the greater trochanter to the floor, 100% of it, use it for your saddle height, and they found that the cycling economy actually better with that, okay, with this measurement. And some, of course, all different things, okay. The third one is 113% length from the ischial tuberosity is your butts. Just put your hand to your butts and feel up, you know, and you feel a piece of immediately a piece of bone there. It's called ischial tuberosity. Now this one you times 113%. Yeah, all these genius here don't how they come up with all these measurements, you know. Okay, but if you want to try that, you're welcome to try that to see whether it suits you or not. If not, then there are something more, what they call slightly more ambiguous but easier to do without using your ruler. Okay, without using your calculator. Now put your heel on the pedals, heel down, okay, and you fully straighten your knee, okay, with the heel pointing down, pointing to the back, okay. That is the height that you want with the knee fully straight. And then when you bend your knee at 6 o'clock position, your knee should be at about 25 degrees of bending. That sounds that sounds easier, right? Now, so again, on the left-hand side, the ideal position is with your knee bent about 25 degrees at the 6 o'clock position. This is like this is the clock, 6 o'clock positions. If you set it too high, you tend to get back pain and groin pain. Okay, I mean it makes sense because your saddle is yeah, you know what I mean. Okay, it's too low, you get a knee pain. You know, you lost power because if your knee is too bent, you try to cycle, cycle too hard, you find that you're not in a proper leverage arm. Okay, your leverage arm is very short, and you have to use more energy. You wear up your cartilage faster, wear up your kneecap cartilage faster. Okay. One suggestion is maybe it's best to film yourself in a stationary bicycle, and look at it yourself, how you cycle. Now again, put your heel at the pedal, adjust until fully straightened knee, step 1. Step 2, you change your foot to the forefoot in front, okay? And going down to 6 o'clock, should be about 15 to 25 degrees of knee bend, okay? When you are at this position, okay? After changing your foot position from heel down to this one. This is a quick one, okay? And what about lay back? Lay back means how front and how back your seat, bicycle seat should be, okay? Now again, there's a guide with whereby it's you put your foot at about 7 o'clock position in this clock with the pedal parallel to the ground, okay? Your foot parallel to the ground, and then you drop a plumb line from the front of the kneecap to the foot, meaning that you use a string, tie something heavy, whatever heavy, a stone or any heavy stuff, put the line in front of your knee, then it should be just in front of the pedal central axis of this pedal. And then you're at the correct position at the front or back of your pedals, of your saddles, or your seat. Now this is an example whereby you put heavy metals there and adjust your seat accordingly until this thing is right at the center axis of your pedal. Then you're at the correct position of the layback. Optimum positions, okay? Wouldn't say correct, optimum maybe. Because if you are at the wrong position, you may get more back pain, okay? But of course, this is just a gross guide. It all depends also, it can depend on a lot of factors on uphill, downhill, and also how you cycle, whether you're using your hamstring or your quads muscle more to cycles, okay? It's different for individuals, you need to test it out. Now, what kind of knee problem does cyclists get? The most common one is, of course, the kneecap pain. Kneecap, again, as I said, the round shaped things, the kneecap, the patella, okay, in front. Everybody can put your your hand and feel in front of your knee. That is a round shaped bone. That little thing is called a kneecap or patella. Okay. Yeah, so there's a lot of patients come and ask me, oh, I want to change kneecap, I want to change kneecap. No, what it means is they want to do a total knee replacement, not change kneecap. That's a wrong words to use. They change the whole knee. It's a total knee joint replacement. But it's very commonly said by laymen, change kneecap, which is absolutely wrong concept. Okay. So anyhow, this kneecap pain is called, in medical term, it's called patellofemoral joint pain. And what happened is you keep on cycling your knee up and bend and straight, bend and straight, bend and straight. You get this kneecap keep on grinding over the thigh bone, and you get it worn out. Okay, that's called a kneecap pain. Okay, and common problem knee pain number 2 is called iliotibial band syndrome. As the picture shows, there is a white color rubber elastic band at the side of your knee going across from the thigh, going all the way across to your shin, and then across the knee. As across the knee, if you cycle, move your band, and again, you can overuse it by rubbing it frequently over it. Okay, how to treat your patellofemoral joint pain, your kneecap pain? Okay, you need to strengthen up your thigh muscle. You need to do frequent stretching with your quadricep, hamstring, and calf muscle, and some taping. You know, if you have that, you come and see us. We will treat you. Okay. Whereas iliotibial band, again, the pain is at the outer side of the knee due to the iliotibial band gliding over the thigh bone. Okay. Usually associated with higher seat position, okay, too high, okay, and increased cadence, meaning that you're really pedaling much more than necessary, okay, using in different gears. And some will develop very tightness in the ITB, in the iliotibial band, tightness in your glutes or buttock muscles. Tightness at the side of this muscle all can cause this iliotibial band syndrome. Pain at the outer side of the knee. How to treat them? You do some lower cadence. Okay, you lower the seat of your height. You do some stretching, ITB stretching, just like this one, and you do some firm rolling. Okay, this is how you treat them. Okay, now we come to the third thing. Running, okay. Yeah, I go through this because I was requested by Ronnie. I heard the Anak Hutan group is very active and they do all 3 of these. Okay, so let's go through a little bit on the running knee pain as well. Okay, 40% of the running injuries are knee injuries. Again, knee is most common injuries. Okay, the number 1 runner's knee is, guess what? Again, the kneecap problem again. Okay, they overuse the cartilage underside of the kneecap, and which is due to doing too much and too fast, or it could be due to naturally wrong alignment. You got a very flat foot, you have a knock knee curve like this, or you have the other way around, either in or out, not ideal. You haven't got it's just like you haven't got a proper alignment on your car tire. Okay, you lack of strength and flexibility. You just too weak. Your muscle have no strength, no flexibility, or joint are too stiff. You're gonna get injured. Okay, equipment problem: wrong shoes, worn out shoes. You are using wrong shoes to run. Okay. Now, running posture and biomechanics, meaning how you run, the style that you run can also contribute to your knee problem. Okay. Okay, naturally wrong alignment. Again, I showed this picture before. A normal alignment is straight. Okay, the knee is straight. Some patients are born with a bow leg. We call it the varus, like O shape, you know, bow leg. And these kind of people, they will wear out their knee much faster in their life. For example, if normal people is supposed to get osteoarthritis at 70 years old, you will get it at 50 years old. Okay, because it's born with the wrong alignment. Never go to the mechanic shop to adjust it, you see. So, and you get a knock knee, it's the same effect. And then on the right hand side, if your knee is too flat, not in alignment, then it can affect your knee joint as well. Now, what does the research say about the shoes, you know? Now, this one particular research shows that it examined 116 runners who run 91% of their mileage on the same shoes. And another 148 runners run 58% of mileage in the same shoes. So the one who use more shoes have 39% lower risk of injury. What does it mean? It means you have to spend more money on shoes, change more pair of shoes. So to prevent injuries in running, you need multiple shoes. Yeah, they're making more money now, is it a shoe shop, right? And you need cross training, meaning that you don't just run, you swim, you cycle. Excellent, just like the Anak Hutan group, okay? Which is, yeah, good tactic, I think, yeah. And be careful of your previous injury. If you have previous injury, then you're more likely to injure, okay, if they're not settled. Okay. So again, those participate in other sports reduce their injury risk 25%. If you run and cycle versus you only run, your risk of injury will reduce 25%. Okay, cross training. Okay, if you have previous injury, the risk of injury this time is increased by 72%. Okay, so now about running posture and biomechanics. Okay, certain running style may increase your risk of getting knee pain. Okay, they increase your risk of getting knee pain. Certain people run at different style. I show you some examples. Okay, for example, this is a runner. If you look at how she runs, she's an elite runner. All right. Now the run is not bad. She's an elite runner. She wins a lot of prize. Okay, but on close analysis and a video analysis of her run, you note that her knee actually go into varus, and then the hip actually drop one side when she land. Okay, and this curve motion here actually increase the stress on her kneecap, her patella, and she gets knee pain like this. Okay, hip drop to one side and the knee curve in. Okay, it causes this kneecap here, the wearing out of kneecap. Okay, right, and also the side, the iliotibial bands, they increase the wear. So in her case, she has knee pain from that. Okay. Another running style that can cause more knee pain is, you see, if you can look at these pictures, these people landed with the knee straight. Again, when landing a knee straight, you have no chance of absorbing the impact from the ground. It goes directly shoot all the way through your knee joint. Okay, and you're gonna get heel pain called plantar fasciitis. You're gonna get knee pain and wearing out. More proper way is the last runners. She has proper way of landing, except that she has a different plane problem. Her fault is on the front. This is on the side. On the side, she looks okay with the foot landing, proper foot landing. Supposed to be a mid-foot landing, okay, not landing on the heel, and landing with a bent knee. Okay, you can do this analysis when you take a videos on the runners. Okay. Okay. So then, what can we do to reduce your risk of knee injury? Okay. Now, it is not knee guard. It is not. A lot of people say wear knee guard and all these things. All these are temporary things, and it does not really help. Okay. More importantly, you need to make sure yourself is well trained and have enough strength and flexibility. Okay. An ounce of prevention is worth a pound of cure. So this quote is true for the knee injury as well. Okay. So researchers screened through 3,500 articles trying to find ways of preventing knee injuries. What are the best preventing knee injury? And they found, they handpicked out 33 best articles in the literatures. Okay, and they found all the program that is effective in preventing injury must include a combination of dynamic stretch, meaning flexibility, a running drill, a strength training, core strength, and plyometric exercise. These 5 things that you need to include in the so-called preventive exercise to make your knee less likely to injure. So this exercise here should be practiced a few times a week to protect your knee. Okay, and if you're a sportsman, you should start before the seasons and continue through the regular season. You do it a few times this week, do not stop. Now, this is a picture of including the type of exercise. I'll go through it one by one. Okay, it prevents your knee from getting sprained and injured, as well as, you know, like if you go hiking or things. Okay, the 5 main components of the knee injury. 5 main components of the knee injury prevention exercise include stretching, strengthening, running drill, core strength, and plyometric exercise. Okay. Right. I think yeah, I think this is probably difficult to understand. I just demonstrate one by one. Okay. Number 1, you need to stretch. Make sure you have flexibility. Quadricep stretching. You stretch the front of your thigh muscle. Hamstring stretching. Stretch the hamstring. Okay. Calf stretching. Stretches your calf. Adductor stretch. The inner side of your thigh. This is like 1, 2, 3, 4, front, back, side, inner side, and outer side. Okay. Make sure you stretch all that. That's component number 1. Okay. Calf stretches. Okay. That's a repetition. Number 2. Apart from flexibility, you need to have strength. Okay, with no strength, you're floppy leg. Okay, so strength, you do single leg squats several times, 10, 20 times single leg squat. Lunges, exercise lunges like this. Okay, and hamstring strengthening exercise. This is a little bit difficult, but it's very helpful for the hamstring strengthening. Okay, this is a very useful exercise to strengthen up your hamstring, meaning at the back of the thigh. Okay. Now, and then you need to do some running drill. That means you run backward and forward, run in a zigzag positions. Okay, train yourself to do that at home. And then apart from that, component number 4, you need to build good core strength, meaning that a plank, 30 seconds of each plank, a front, 1 leg plank, and side plank. Okay, Plyometric exercise is like a bombastic exercise that you use it. This is the last component. Plyometric exercise just means that you have a sudden burst of movement in a short intervals of time that help you to build your strength. So, okay, it's really helpful to improve your strength. Okay, for example, is just jumping over some, can be bigger than that, single leg jump. Okay, example number 2, sideway jumping. Okay, sideway jumping. These are plyometric exercise. Okay, so in summary, exercise is good for your knee. Okay, it does not increase the risk of arthritis, but the injury does if you're not careful. Okay, it's the injury that causes arthritis, not the exercise. Okay, so you must prepare yourself to prevent injury through the injury prevention program, the 5 components that I gave you. Practice it several times a week at home. Correct equipment, get a proper shoes, proper trekking poles, proper bicycle feet, correct technique, correct running techniques, okay, correct running style, and things like I talked about just now. Okay, so thank you very much for your attention. I hope that makes sense.
So thank you, Dr. Tang, for the talk.
Yes.
So whoever that has question that would like to ask doctor to have our doctor to address, you can write down the question in the chat box. So we have one question here, doctor. Is glucosamine and chondroitin the best for supplements for prevention knee pain? If not knee pain, if not, what can we take for the knee pain?
Actually, that sounds like a favorite question. You know, you always get asked. Unfortunately, glucosamine and all this supplement does not. It's failed the test of the literature. Actually, it's in the big studies does not show that it's beneficial. Does not show that it's beneficial. The evidence is not strong enough. Okay. Despite that, for the survival of our pharmacies and our and other supplement shops, you know, yes, you can take it. Not to say you can't take it. There are still, I still see people that we gave and they have improvement, at least in terms of symptoms, you know, wise. Yeah, I think glucosamine so far the most popular one with glucosamine and omega-3. So you can take it, there's no harm. Okay, I don't think there's too much harm now. It's relatively safe. Okay, but if you ask me whether it works or not, the answer is no evidence, unfortunately. Up to date, the big study does not really support it. But sometimes it's kind of hard to say also because it's difficult to prove something. In science, there's always something that is very difficult to prove. I give you an example. If science is that science is a certain thing, they always want you to compare. So you must have the evidence of comparisons, you know, yes and no, then only you get the proper answer and they say yes, this would. For example, if I ask you a question, does parachute help to reduce your death if you jump down from a plane? Okay, how do you conduct a study to compare people with a parachute jumping down from the plane versus people without a parachute jumping down from the plane? How to conduct that kind of study? So it's sometimes difficult. That is why, yeah, that's my answer. All right, and any more questions?
Any other question from the audiences?
You can type or you can speak.
Any further questions?
Okay, I
Okay.
see this.
How about swimming?
Okay.
Can improve knee pain?
How about swimming? Can swimming improve knee pain? Swimming actually, as I said, cross training is considered cross training. Cross training means that you actually do other variety of exercise. When you swim, your knee is not under stress. Okay, so you get adequate rest because of that. Okay, you must look at it that way. Swimming does not directly improve the knee pain, but it indirectly improve the knee pain because you actually spend less time on hiking. You know, your knee got time to rest. That is why it's improving. And swimming is a good exercise for those people with bad knee. Okay, because your body weight does not load on the knee when you do swimming. So it's a good form of exercise. All those people with knee injury, I will ask them to, okay, you can go swimming, you know, because you can't ask them to go hiking, you can't ask them to go play football yet. Then swimming is a good form of replacement exercise in that sense. Okay. Okay. And then there's
Another question here. Does injection gel to knee really can help to solve knee pain?
Yes, it has been proven to reduce your knee pain or improve your symptoms because the gel injection is like a visco supplement that inject inside the joint. It reduces the inflammation. It reduces the friction inside the knee joint. Yes, it has been well proven to relieve the knee pain symptoms. Yeah.
Hello.
Okay, doctor, we have another question here. It's actually from the YouTube live. Okay, so is it cartilage worn out problem if there's popping or crackling sound when bend knee or squat?
Is cartilage worn out problem if there's popping or cracking sound when bend knee or
It
squat?
means when you have popping or cracking sound when you bend the knee or you squat, is it due to cartilage worn out problem?
Most of the time, yes. Most of the time, yes. But happen to say that there are a lot of patients with popping sound on the kneecap, but do not have any pain. Okay, that is due to the imperfection of that joint. Okay, the kneecap goes up and down along your thigh bone and shin bone on a groove. Okay, it's like going up and down like this every day, cycle over cycles. If the thing is not perfect and it's shake, you know, like it goes unstable due to the muscle imbalance or imperfection of the joint, then it can pop. But if it has not reached the severity yet, you do not have pain yet. You do not have pain yet. Okay, that is why there are a lot of young girls, especially, they have imperfect kneecap joint. I mean, just like your car tire alignment is not properly aligned, you know. But they never have pain because they never actually overuse it. The car is driven in Penang Island round and round only. They never go up to KL. If they were to go up to KL and back every day, then they probably get pain.
All right. Any further question from the audiences?
Hello. Hello. Can you hear me?
Yes,
I heard somebody.
but you got to be louder.
Can you speak louder?
Okay. Yeah. Back to the hello. Can you hear me now?
Yeah.
Hello. Yeah. Back to the gel injection question. I just want to know. Normally, the gel injection, right, can last for how long?
How long does the gel injection last? Okay.
Yeah.
It depends on which brand of the gel. Okay. All different brand of the gel will stay inside the joint for different duration of time. Okay. Depend on the brand of the gel that you use. Okay. But in general, most of them will stay inside even the longest one will stay inside your joint, probably the best one probably maybe 6 months, not very long, okay, as a lubricant effect. But when they get absorbed, after that, they get absorbed by your body, okay, get absorbed by your body, hopefully by your cartilage. The purpose of the gel also, they meant to be absorbed through that and to promote your knee. Hopefully they promote your knee by promoting your knee to secrete more of this own gel, okay, to promote the more healthy environment of the knee joint. That is the purpose, the part of the purpose of what this gel is designed to do, okay.
So if let's say I keep doing some extreme exercise, so will it like causing the consumption of the gel get finished faster, or it actually doesn't matter?
If your knee if you're still quite young, number one, if you're still quite young, your voice sounds quite young, okay, so you may not need this gel injection, you see. You only need to do the preventive exercise like what I showed just now. Make sure your knee is well balanced, is strong and flexible, and you train yourself through all this plyometric and make sure your core strength is good. And all this will protect your knee much better than the gel. Okay.
Okay.
Right. So.
Okay, and then sometimes I saw in the YouTube, right? Some people they recommend some squat or bending exercise. They claim that this can help actually to generate the gel or somewhere in the knee. I'm not sure
no proof of that.
it's true or
There's
not.
no proof of that. It's purely their imagination.
Oh, okay.
This is purely their imagination.
Yeah. I saw quite lots of YouTube about this one.
Yeah. That's a problem. This is all claim. It's not scientific. I ask you, if I ask you to do a study, you prove that. How am I going to put something inside the knee and monitor you and see whether your gel increase? I can't put a camera inside your knee joint and look at your gel, see whether your gel increase or not when you do that exercise or not. So
Yeah.
it's impossible to prove. It's just a claim, okay? And how do they know that? That is just a claim.
Before and after. Yeah, okay.
That is nonsense, okay?
Oh, okay, got it. Okay, thanks.
Okay, we have another question here. How important is the type of shoes to knee injuries, like movement control or movement correction shoes, that are those that which control pronation?
Whether you need movement control or movement corrections or all these things depending on your foot types, okay? So you can go to your local shoe shops with more professional help to look at the type of foot arch, how flexible, how stiff is it. Let's see, like those which control pronation to knee injury. I think it does make some difference. It does make some difference. However, I must say that this has been overly inflated. Overly inflated. When people want to sell their shoes, they overly inflated their benefit. If you have a very flat foot, very flat foot, you must understand that the shoes will not correct your flat foot. It will not correct your flat foot. Okay. The only thing that correct your flat foot is actually surgery, unfortunately. Okay. but it can obtain some relief from the arch. Okay, yeah. In a way, it's to certain limit it help to prevent the knee injury. I still recommend it to use. Recommend to use if you really have a pronated foot and arch support. Yes. Okay. But it's just overly inflated, overly glorified as if by a lot of medias, as if this will solve all the problems. You know? Does that answer your question? I hope it does.
Sorry, doctor. Question regarding the question asked by one of the previous question. Just now you claim that only surgery can help for those who have the flat foot. I mean, the shoes wouldn't help much on those who have flat foot. So how about I thought that the hospital normally they will ask the patients to buy something to insert inside the shoes.
Yep, insole.
They will check. Oh yeah, insole. Oh, okay, insole. So that one doesn't help much, or that one?
It does not correct your flat foot. Your flat foot will not become a normal foot after wearing this.
Will not become a normal foot.
Yes.
So
the flat foot will remain flat. The moment you remove, number one, the moment you remove the insole, you're back to square one. Okay.
Oh, okay.
And also, in a more severe flat foot, it will not fully correct it. Okay, it's like a temporary thing, right? The moment you're wearing it, like your foot is protected and all this. But the moment you remove back, you're back to normal. Okay, some people may misunderstand that you wear your insole after a long time. Wow, your foot will become like that again. It doesn't. Okay, it remains flat. Okay.
But it is still helpful, right? When we wear it for running.
Yes, it's still helpful. Yeah.
Oh, okay.
Doctor, there's another question from the YouTube live. So the question is, can surgery help to correct the venous alignment?
Yes, definitely. Yeah, we can correct the varus alignment, varus alignment on knee by doing what we call a high tibia osteotomy. But essentially, you cut the bone and adjust it and fix the bone at that angle. It's called a corrective surgery. Yeah, but we normally don't do it unless it's quite severe and the patient has a pain. We don't do it when patients do not have pain. Okay, yeah, partly because we don't like to do that, because if the patient does not have pain, then later after operation they have some pain, then they're not going to be happy. Okay, but essentially, yeah, it's not too difficult, you know. Yeah, it can be corrected. Yeah, all deformity can be corrected with that.
All right, thank you, Dr. Tang. I think that's all the questions that we have for today. Kenny, is there anything from your end that you would like to add on?
No, I want to thank Dr. Tang for host this this talk for us. In fact, I know difficulty for Adventist these 2 days due to the COVID-19, and also most only need to quarantine also So thanks for your help also to host this one for the YouTube also for me.
You're welcome.
All right.
So,
once again, thanks to everyone for joining this talk today. And so if you would like to, you have any further question for our doctor, you can actually make an appointment through our hospital mobile app. Our mobile app is called Penang Adventist Hospital, which you can download and to check on doctor's availability and can make appointment directly through the apps. So you can then, further your question to Dr. Tang, for consultation. Thank you so much.
Okay.
Have a good day.
Thank
you. Thank you.